cost. Now, turns out it isn't just the Post and the Times that have such concerns. There's an article on Reuters, and Reuters says that China is now questioning the cost of our U.S. health care reform. Since China buys so much of our debt, turns out they have a vested interest in making sure that we have our financial house in order. And so, to read the article from Reuters, guess what? It turns out the Chinese are curious about President Obama's health care reform plans, how it will impact America's huge fiscal deficit. And the government officials are using President Obama's Asian trip as an opportunity to ask detailed questions. Boilerplate assurances are apparently not cutting it. I think it's important for we as an American people and our country to look at the bill that was just passed, that is going over to the Senate, and to analyze how well does it control cost. Are the Chinese correct? The Washington Post, the New York Times, are their articles correct? Or does it indeed actually control cost and everyone else is a little bit confused about it? Well, let's go into that. First, remember our three imperatives. You have to decrease administrative cost. You have to incentivize healthy lifestyles, and you have to put in cost transparency. Let's talk about incentivizing healthy lifestyles and how you do so. Now, as it turns out, when the President talks about preventive medicine, one of the kind of dirty little secrets of this, and as a physician I can say this, if you're talking about things such as colonoscopy, actually if we did a colonoscope on everybody over 50, as per the current recommendations, it actually costs the system a little bit more. Now, it's a good cost. If you find a polyp, remove it, and prevent cancer, that's actually a very good thing. But it doesn't save money. But there are some things you can do that will save money. If you can get someone to stop smoking, it actually saves the system money. It also helps them in terms of their health. If you can get someone to lose weight, it actually saves the system money. General Motors did a study. They've got so many employees they can do this sort of thing. And they found that for every 10 pounds that an employee lost, that their health care costs went down significantly. If the person had high blood pressure and they lost 10 pounds, the blood pressure got better. They required less medicine. If they had diabetes, the diabetes became easier to control, or in some cases, diabetes will go completely away. Now, there are ways that you can incentivize healthy lifestyle. Under the current law, companies are allowed to decrease by up to 20% the premiums they charge their employees if the employee participates in a wellness program. So, for example, Safeway, which is a large grocery store chain across the United States, had a program where they will decrease their premiums by 20% for those employees who participate in a smoking cessation program. When they do so, they find that people, surprise, surprise, stop smoking. Similarly, if someone joins an exercise program or a dietary program if they're overweight and they lose weight, now, frankly, as I recall, the way it's structured is that the person just has to join the smoking cessation program. They don't actually have to stop smoking. But just as it turns out, people, if exposed to information, act on that information and they adjust their lifestyle. So either by an exercise program, a dietitian, or by smoking cessation programs, by participating in these, they will lose weight, and Safeway has kept their cost for their health insurance constant, whereas there's been about a 7 to 10% inflation rate over the United States. I just met with a company based in my hometown of Baton Rouge, Albemarle. And Albemarle has been having about 10% inflation rate. But the last 2 years ago, they instituted a program where they first had all their employees come in for a health assessment. Last year, they had all their employees come in for a health assessment. For example, do you smoke? Are you overweight? But also a physical exam. Next year, they are putting in, as a covered benefit, a smoking cessation program. And then 2 years from now, this is a 4-year process, 2 years from now, they're going to decrease premiums for those that participate in these smoking cessation programs. Their premium costs, which have been increasing 7 to 10% per year, are projected to only rise 3% per year when they institute the full program. So by putting in or incentivizing healthy lifestyles, they're going to lower their inflation rate to 3% per year. Now, H.R. 3962 actually weakens these provisions. Republican amendments offered in committee would have increased the amount an employee could save if she participated in a wellness program. But these were defeated basically on party line votes. Similarly, there is a disassociation in H.R. 3962 from what a company can do to incentivize healthy lifestyles and how this provision works. As an example, H.R.